Good morning and welcome everyone. Thank you for joining us for today's webinar. I am Nikisha Davis and I serve as first vice president for the Jackson, Mississippi alumni chapter of Delta Sigma Theta Sorority Incorporated. Today, we are kicking off our World AIDS Day awareness activities with a webinar presented by our International Awareness and Involvement Committee. Thank you for rocking the ribbon with us as we are on a mission to end an epidemic during a global pandemic. We are sure that today's dialogue will be full of informative and beneficial information. So let us begin. Our moderator for today is Dr. Mauda Monger. Mauda Monger is a native of Jackson, Mississippi. She has a Bachelor's of Arts in Economics Business Administration from Tougaloo College and a master's degree in public health and a doctoral degree in higher education leadership from Jackson State University. Mauda serves as Chief Operating Officer at My Brother's Keeper Incorporated, better known as MBK, where she works to ensure that MBK continues to be innovative with a structure that is focused towards eliminating HIV and overall health disparities. Dr. Monger is also the founder and CEO of the She Project, a nonprofit mentoring organization with a mission to address gaps of knowledge, opportunity, and networks for minority girls and women by offering exposure to multifaceted experiences accompanied with education, physical mental health, career, social change, and community service with an intention to cultivate leadership skills. She is author and co-author on numerous papers, abstracts, and presented extensively on HIV prevention, stigma, social determinants of health, and special populations such as racial, gender, and sexual minorities. Her research expertise spans both public health and higher education. Focusing on community education and health, Monger is driven by the mantra, to whom much is given, much is required. When she is not educating, mentoring, or speaking, Mauda enjoys journaling, traveling, or just a lazy day on the beach. Please join me as we welcome Dr. Monger.
Thank you for that wonderful introduction. I am so excited to have you all here today to have this conversation around HIV, a very much needed conversation, but I am more excited about the people we have on our panel today. These people combined have a wealth of knowledge from both the technical side of HIV, meaning treatment and testing, to the pharmaceutical side, all the way to a lived experience of HIV. So having you all here today is such an exciting piece. I'll go ahead and start by introducing my panelists, and I'll have each one of them to just give you just a few moments, a couple of minutes about who they are and what they do. So we're going to start with attorney Linda Dixon. She is a lead attorney at the Mississippi Center for Justice. So Linda, can you just tell us a little bit about who you are?
Good morning, Mauda. And I am so thrilled to be a part of this conversation and celebration and acknowledgement of World AIDS Day. So thank you so much for this opportunity. My name is Linda Dixon, and I'm the health law attorney at the Mississippi Center for Justice in Jackson, Mississippi. We are a nonprofit public interest law firm, and I primarily work on access to healthcare issues and issues related around HIV discrimination and stigma, where we provide legal services to people living with HIV, public policy, and outreach and education.
All right, awesome. Thank you so much, Linda. I appreciate that. So our next panelist is Dr. Shanell McGoy. She is the director of the Compass Project at Gilead Sciences, a biopharmaceutical technology company based in Foster City, California. Where they focus on antiretroviral drugs for HIV, hepatitis, as well as COVID-19. So, Dr. McGoy, thank you so much for being here today. You can take a moment and just tell us a little bit about who you are and what you do.
Thank you, Dr. Monger, for having me this morning. I really appreciate it. And I want you to know that Dr. Monger sounds good on you. So congratulations.
Thank you.
Yes, my name is Dr. Shanell McGoy, and I am Director in Public Affairs, Corporate Giving with Gilead Sciences, where I oversee the Gilead Compass Initiative. It's Gilead's 10-year, $100 million commitment to address HIV in the Southern U.S. And prior to coming to Gilead, I've spent about 20 years working in HIV in governmental settings, community-based organizations. My last role was Director for HIV, STD with the Tennessee Department of Health in Nashville, Tennessee. And I'm also the proud wife of Dr. Terry Powers Jr. and mother of Dr. Terry Powers III, who just turned 1.
I just love him. I love him. So Shanell and I go way back, which is why she's known about to the PhD. So thank you for always providing such support and guidance, and just being one of my she-rolls. So thank you so much for that. Next, we're going to bring on Miss Jennifer Brumfield. She is a registered nurse at the University of Mississippi Medical Center. Jennifer, are you here with us?
Of course I am, Mauda, and Mauda is one of my sheroes. I am so just proud to be on a panel with so many well-known African-American women and men who are doing so much for our people. It's really humbling, honestly. I have had the pleasure to know Mauda, Dr. Mauda Monger. That does sound so welcoming on you. It's been such a pleasure to get to know you, work with you, and learn from you. But I've had an opportunity to work at the University of Mississippi Medical Center and be the manager of clinical research for infectious disease, be the director of clinical operations for Express Personal Health, and be empowered and encouraged by Mauda and so many others to also pursue my PhD. So it's been humbling. It's been something that really changes your mind. It changes the way you approach things. So it's awesome just to be here and contribute to this conversation.
Excited.
We can't have too many of these conversations.
I'm so excited. Again, Jennifer and I go way back, so we see each other in some really, really tough situations, especially here in work. Like you and I have been in this work for a long time as well. We've been in this work as well as Linda. We've been in this work for a long time, and we've been in together. Next panelist I'm going to introduce is Miss Latunja Sockwell. So Latunja, are you here with us? Tell us a little bit about who you are, and we're so excited to have you today.
Thank you. So I'm Latunja Sockwell. I do work for the University of Arkansas for Medical Sciences. I am a lead HIV evaluator. I won't say researcher because most of the work we do is evaluation. So I evaluate a lot of project outcomes around HIV. I have written some grants around HIV, partnering with drug courts, treatment sites, and other high-risk areas, and also focusing on women. My focus on women is because I am also an HIV positive woman. I have been HIV positive for 23 years, and so when I first moved to Little Rock, Arkansas, that led me to wanting to be more active in trying to get women aware of their HIV status and making sure they have those right conversations. So I'm looking forward to this conversation today, and I hope you guys are ready.
We are excited to have you here today. So excited. Thank you so much for coming in and bringing this, very valuable conversation to part. We do have an additional panelist. He's not with us just yet, so he'll be joining on in just a moment. Pastor Willie Tobias from the New Mount Zion Missionary Baptist Church. When he comes in, we'll introduce him. But in the meantime, let's get to why we're here. Let's get to these questions. And I am going to really try and dig in with these questions. I want you all to be very honest with the people who are here. We want people to get honest, real answers. This is an opportunity to provide so much education. So we don't want to miss out on this opportunity at all. So we all know what the stats look like for the South, right? So just to remind our attendees that right now, in the United States as a whole, roughly in 2017, we still had about almost 40,000 new HIV diagnoses, right? An estimated 1.1 million people were living with HIV. While about 14%, anywhere from the numbers range from 1 in 5 to 1 in 8 people are HIV positive and unaware of their infection, which makes the work we're doing so very valuable. Now, when you start to think about the South as a whole, Southern states now make up 51%. Yeah, did y'all get that? 51% of the new HIV cases each year. Now, I'm going to shoot the first question to Dr. McGoy. The work that you all are doing, it really has been focused in the South. So with that being said, how did Gilead's Compass program come about? And what exactly is Compass?
Sure, thank you. So the Gilead Compass Initiative is Gilead's, again, 10-year, $100 million commitment to address HIV in the Southern U.S. And so Gilead in the spring of 2017 had a leadership team that traveled throughout the Southern U.S. to really understand what is driving the epidemic of HIV in the South. They talked to leaders, they talked to people living with HIV, they talked to providers, they talked to community workers, they talked to an array of people to understand how complicated the issue is and what are those drivers for HIV. And so they came back to Foster City, California, came up with this idea for the Gilead Compass Initiative. Again, 10-year, $100 million commitment to address HIV in the South. And what we're doing is focusing on 9 deep South states. We're talking about Florida, Georgia, South Carolina, North Carolina, Texas, Mississippi, Alabama, Tennessee, and Louisiana. And so with that, the Gilead Compass Initiative has a goal of creating a lasting impact in the Southern United States with three ways, 3 things that we want to do. We want to change the public perception of HIV and AIDS in the South. We want to improve access to and quality of healthcare services for people living with HIV in the South. And the third one is to increase local leadership and advocacy in the South. And we do this by funding what we call a coordinating center model. So right now we have 3 centers who have 3 specific focus areas. That's Emory University, who focuses on capacity building and shared knowledge. University of Houston, who focuses on mental health, trauma-informed care, and substance use. And then finally, the Southern AIDS Coalition, who focuses on education, advocacy, and reducing stigma. And so those 3 organizations then fund community-based organizations and partners throughout the South. They provide grants to community organizations, they provide trainings, as well as what we call cohort learning experience. So that may be a group of nonprofits that come together to go through a shared experience for maybe 9 months to 12 months to 18 months, where they're learning together and growing together around the content of HIV and building the capacity of their organization.
That's some amazing work. You mentioned all of the specifically the Southern states. So I think that for us here in Mississippi, we don't oftentimes think about being in the South and how it's become a hotbed for HIV. So Linda, with the work that you do as an attorney, when we're talking about these numbers, like in Mississippi, for instance, last year we had 400 plus new HIV infections, right? So that is 400 plus. So we're talking like 473 new cases of HIV. as an attorney, how does your work intertwine with these extremely high cases? So what does an attorney do as it relates to HIV?
So what we do is at the Mississippi Center for Justice, we do a lot of different things to help people living with HIV. One, we provide free legal services for people who experience employment discrimination, housing discrimination, privacy violation, and these things happen because of stigma. If somebody encounters an issue with their housing and they have experiences with a landlord and they are evicted or harassed in any way, then we provide services to that person. We also have a very unique medical legal partnership where we provide legal services to people living with HIV through medical partners who help us to identify their patient's needs and they refer that patient to us. So it's a very unique opportunity from a holistic standpoint when a provider sees a patient and they can identify that there's an issue. For example, if they're not compliant with medications, it could be because they don't have stable housing, which is a basic need for everyone, whether you have HIV or not. So that's really important. Another facet of our work is doing stigma trainings. We do stigma interventions and trainings. Internalized stigma is huge. It's big because if you have stigma coming from everywhere, whether it's discriminatory policies, practices, or just people, doing stigmatizing things, how that affects someone living with HIV, or even the perception that someone may be living with HIV and stigma that plays in that way. So we help to train as many people as possible. We work with peer groups. We work with community-based organizations, aid service organizations, and others, anyone who will have us, faith leaders, to come in and actually talk about stigma, what that looks like. Somebody may know this doesn't feel good. I know something's wrong with this without knowing that it really is a stigmatizing action or stigmatizing behavior. And so we also do policy work. And one thing that I'd like to highlight is HIV criminalization. Mississippi, as does many states, in southern states, but it's all over the country. But right here in our state, we have a law in the book that basically stigmatizes and criminalizes HIV, the disease. And it basically says, and I'll just, just a little piece of it, if someone is living with HIV, hepatitis B or C, and exposes, not transmits, but exposes another person through bodily fluids, urine, blood, saliva, feces, that they can get up to 10 years in jail. If they do not have HIV, hepatitis B or C, and expose someone to the same bodily fluids, it's a year. Now, first of all, that's wrong on so many different levels. And, being so punitive and something that is not even possible to transmit HIV, it's hard to through urine, saliva, and feces. So from a scientific standpoint, the law is flawed, is wrong. And people are actually being arrested and prosecuted based on inaccurate science and on a law that is highly discriminatory, highly stigmatizing to people living with HIV. And what that does, it prevents people or discourages, I'll say discourages, people from getting tested. It discourages people from even going into care. And lastly, it discourages people from disclosing. The fear of disclosure can get you arrested. So that on its face. And so we do a lot of different things. So those are the highlights of as an attorney, what we can do to support people living with HIV and people who love people living with HIV. You know, when I started doing this work about 10 years ago, I was completely blown away. As Mauda, you pointed out the numbers, and the numbers keep getting higher. So we have a lot of work to do, and we have a lot of work to do around that.
That brings so you brought me into a couple of different ways that I want to certainly bring in. So Pastor Tobias is with us now, so excited to bring him into this conversation, because as we're talking about stigma, so Linda, you mentioned how HIV is transmitted. Jennifer, if you can touch a little bit about not only about transmission, but how that impacts access to care, and more importantly, access to even prevention services. So can you touch on those things a little bit?
Certainly. What we've seen is that there's so much, again, stigma related to people just accessing care. Just the Jackson Medical Mall, period. Just coming there says something about you. There's something wrong with you if you go there. And what I tried my very best is to push coming to the doctor is nothing wrong with that. There is no reason why STD, HIV testing services, why are they not incorporated into general wellness exams? Why are we isolating those testing opportunities? So when we have these pockets of STD, why are we continuing to make a LGBT friendly environment instead of just incorporating them into normal healthcare facilities?
Right.
That's the answer. So why do we have to have infectious disease specialists to care for something that we say is normal? Why?
Yeah.
So incorporate that into regular family medicine clinics. Incorporate that into regular internal medicine clinics. And just like if you're a complicated diabetic patient, then you go to an endocrinologist. Do the same thing for a complicated or a patient who has HIV, who has a lot of different types of mutations. Okay, so then that too goes to the infectious disease doctor, but incorporate into that, and then that way you make where the family medical doctor is seeing any type of patient, and then no longer does the stigma exist. And so we have a lot of clients that come to us and they appreciate the express model because we're getting them in and out faster so that they don't feel like they're there for that stigma. They feel like they're coming to us and we're seeing them on a fast basis, but we're seeing you regardless. We're going to treat you the same regardless of what's going on. And we're going to get you in and out of the door, and we're going to take care of whatever your needs are regardless of what's going on. Even if you are HIV positive, we're still going to do your STI screening regardless of what else is going on with you. And also, guess what? When you come in the door, if your blood pressure is high, we're going to get you to somebody that's going to take care of your blood pressure, because it doesn't matter if you don't have STDs, if you're going to die of a heart attack in 10 years.
Yeah.
So we're looking at it as a holistic care model instead of just trying to make sure you don't have STDs. So
that is so valuable, Jennifer. I think what you just brought up, even speaking about the testing being fully incorporated. So LaTundra, you've been, so honest and brave with us and telling us that you are a person living with HIV, right? Yes. So what was your testing experience like? And do you think that maybe had you been tested, you tell your story. I won't tell your story. Tell us a little bit about your story with getting tested for HIV.
All right. So I am from Arkansas, like I said. And so 20 years ago was very different 23 years ago was very different from where we are today. I lived in rural Arkansas. So I lived in small town, Southwest Arkansas. I was in the church, and I actually missed a night of revival that night, and that was the only reason. After I went and visited my pastor's wife the next day, she asked me, told me it had been prophesied at church that someone had HIV, and she asked me to go get tested. And so I followed the instructions of my pastor's wife because me and her were close and I trusted her. And I went to the doctor and I got the HIV test. That was the only reason why I would have gotten an HIV test at that time. And so when I got my results back as being positive, I wasn't surprised because God had kind of prepared me over that weekend prior to for those results. And so when I got my results, it was the first that my doctor had given as a positive. He cried, and I kind of consoled him and told him I was going to be okay because I knew that God had me at that point. You know, it was for a reason. I don't feel like God punished me or anything. I feel like this is a blessing because it has kind of led me to where I am. I've always had faith in God that He would always keep me. And so that has led me to where I am, working with different individuals, working in the faith community, doing some of the HIV work that I do, doing the research that I do, being able to focus on women. I love that the nurse was able to talk about some of the things as far as being able to change the scene of what HIV looks like, because those are definitely some of the things as I've gone through school and learned more and moved up in my position at the university to be able to do some of this. These are definitely some of the things that we're writing grants for, to explore how to write a protocol for primary care physicians to be able to treat patients and then when to refer those patients out. And having those conversations with the primary care physicians about just talking to individuals about sexual health, not even about their risk, but just talking to them about sexual health, period, and throwing in some of the HIV stuff and the prevention kinds of things. Because then you're not stigmatizing individuals as they're coming in for those tests, and also it makes it like universal. Everybody knows the same information and it's getting out there. And so then again, you take away some of that stigma. So those are definitely some of the things that we're working here on in Arkansas on, trying to just like figure out how to get that information out there. And me sharing my story is part of that, because a lot of individuals, as I share my story, say to me, well, I'd never met anybody with HIV. And I tell them, I say, you probably have. They were just scared to tell you. And so until
that is such a powerful statement.
Until people are faced with their fears and are able to ask the questions that they have about HIV and what is life like with HIV, then they will be able to open up and understand what HIV is. But we have to have those individuals that are ready and willing to share their stories and be that open book for people. And you don't find many people here in Arkansas because of all of the things that you guys addressed, the stigma, the not wanting to go to the doctor because of fear and all of those things. Here in Arkansas, and I thank God for my pastor's wife every day that I got tested, because here in Arkansas, individuals are about 50% of individuals that are being diagnosed with HIV are getting a dual diagnosis of AIDS. It takes about 10 years for HIV to progress to AIDS. And so you're telling me in that 10 years, these individuals have not been to a doctor. They've not had a conversation about their sexual health. So that says to me that there's a lot of work to be done here.
You mentioned quite a bit about the faith community and how your actual role in the faith community has played a vital part in just you getting tested. So, people who are listening, take heed that it was not her doctor. It was not her doctor who told her to maybe you should consider getting tested for HIV. Oftentimes we leave our health in the hands of our provider. And yes, they are charged with providing us care, but we are our own MVP. You are your own MVP. You are your greatest advocate. But I thought this is an ideal place to really bring in Pastor Tobias. In the Black church, there's a lot of stigma around HIV. So I want to say thank you first for even coming on as a lead pastor lead pastor at New Mount Zion here in Jackson, Mississippi, to even be willing to have this conversation about the Black church and its role in HIV. So Letitia so bravely told us that it was her pastor. As a pastor, what are you doing as it relates to HIV to increase the knowledge, awareness, and even testing of your community and parishioners around HIV?
All right. Thank you, Dr. Monger, and forgive me for my tardiness, with technical difficulties. You're going to always encounter some type of obstacles, but thank you so much, and I've enjoyed what I've heard thus far. But as serving as the pastor of New Mount Zion Missionary Baptist Church here in Jackson, I believe that ministry, first of all, should be a holistic approach. I think I heard someone mention that earlier. We like to use the motto that we are the friendly church that loves and cares. So I want to say, first of all, that I think it's imperative that we care about the spiritual, the physical, and the emotional welfare of human beings. That being said, at New Mount Zion, we're trying to take an active approach in the physical well-being of individuals. Well, this coming Sunday, the first Sunday in next month, we're going to have what we call Immunization Day. And what we're going to do is we're going to provide flu shots, pneumonia, shingles, things of that nature, because we want to show individuals that we are concerned about their physical well-being. Now, with the HIV and the AIDS that we're dealing with, I think in the African American church, one thing that is killing us is this silent approach. For whatever reason, there is a stigma attached to HIV that basically says it's a disgrace, and those who are attached or those who have this illness are an embarrassment to the community and to the church. So I think initially it is imperative that we have what I call an initiative that says silence is death, which literally means we have to get to the point that we are not silent about the issue. When we are silent, that brings about death to the community. So it is imperative for us to speak up and start addressing preventative methods. And even when I talk about awareness and preventative methods, in the Black Baptist Church, some conversations are just not had. We don't even feel comfortable even passing out condoms in the church. So when it comes to awareness and preventative methods, we have to get to the point that we are open and honest with individuals about what we're dealing with. And until we are able to do that, it's going to be even more difficult for us to bridge the gap, if I could say it that way.
So actually one of the panelists, has thrown a question in, and this is what this is. This is that conversation, right? Everyone just has privy to this conversation. So, Pastor, do you think that stigma is related to homophobia or sex or both?
Oh, combination, because when it comes to homophobia and when it comes to homosexual activities, the church has gotten to the point where we force individuals to make a decision as it relates to their relationship or their religion. And when you force individuals to make a decision with relationships and religion, then, individuals who are suffering in that homophobia area are going to lose their relationship. And until that walks down, we'll forever be beating ourselves against dead horse.
Look, Pastor, listen. We didn't expect you to preach on a Saturday morning, but we appreciate it because
I think the issue is that's the issue.
Absolutely.
We all know what the Bible says about relationships and marriage, things of that nature. But at the same time, I think it becomes imperative for us to exercise wisdom to know how to approach individuals, how to have conversations with individuals, and then allow them to know that they're still loved, they're still welcome to church regardless of their beliefs.
Yes. That just brings up so many things, because we're talking about the Black church, but when we're talking about Black people, period. So the fact that a Black person living with HIV in Mississippi is 6 times more likely to die That was an article that just came out in the New York Times. Did you all hear that? Wow. If you're Black and living with HIV or AIDS in Mississippi, you're more likely to die, right? That is a scary, scary statistic. Now, Dr. McGoy, you threw that out to me, and I appreciate that. But with throwing that out, is some of the work you all are doing, are you all focusing in particular on this high-risk community, meaning African Americans? Is there a focus in the Compass Project for that?
Most definitely. When we talk about HIV in the Southern U.S., as you mentioned, the statistics around Black people living with HIV in the U.S. as a whole, but then in the Southern U.S. in particular, you know, the fact that you just mentioned from the New York Times article that just came out last week, that the fact is that a Black person living with HIV in Mississippi is more than 6 times more likely to die of HIV than a white person in New York. And so when you hear that, that's what the Gilead Compass Initiative does, is to try to improve access to and quality of health services for people living with HIV in the South. And so we do that through, for example, there's an organization in Alabama, and an organization that provides care, integrated holistic care, not just HIV care, but they've integrated that into primary care services. And so one of the grantees in Alabama is talking to a grantee in South Carolina. Gender Benders is the name of their organization that focuses on the transgender community and provides care and services and support for transgender community. And so to hear those two organizations, one in South Carolina and one in Alabama, talk about how you can make your services at a primary care clinic that's throughout Alabama more inclusive for transgender persons. And, you know, the faith piece is something that's so important. And so, you know, the question that you asked me about caring for Black communities. So when we're in the South, we're also focusing on Black communities as well as Latinx communities, as well as LGBTQ communities. And for the pastor, you know, I just mentioned that I have a 1-year-old. And so, you know, I sing to him, Jesus loves the little children, right? Many of us know that song. And I also say to him, straight, queer, bi, and trans, Jesus loves us all.
That's right.
To my child. So it starts early. It starts early in teaching your children to love and reteaching the mature folks and seasoned folks to love all of us. And through that love, we can overcome the stigma related to HIV.
I think what you brought up was a very valuable point of leading this effort with love. Pastor Tobias started that. I think you finished that on leading this work with love. For all of us that are in this work, I think that's what we lead with, right? We lead with love, especially as you mentioned the LGBTQ plus population. You mentioned the persons who are of trans experience, as well as the Latino and African American community. Just as the stats relate to HIV, those are the populations that are the highest impacted by this disease, right? So at the start of the HIV epidemic, it was young, white, gay men. That was the start of this epidemic in the 1980s. And here we are almost 40 years later. And here, specifically in the state of Mississippi, again, I mentioned 478 new cases last year, but 353 of those cases were Black people. Yeah. 353, 275 were men, while 28 were women. That put Mississippi in a place where we have the 8th highest HIV diagnosis rate in the country. 8th highest HIV diagnosis rates. Extremely high rates. What I wanted to bring in, Jennifer, tell us a little bit about how is HIV transmitted. I tell people all the time, it's the easiest, hardest disease in the world to get. So
it is.
Tell us a little bit about that.
It is. So it's interesting, and I was actually, I'm glad that you pivoted that to me, because what Mississippi also is number one in gonorrhea and number 3 for chlamydia. We're number 7 for syphilis. And if you recall, if you look at the trends, our numbers for syphilis are now higher than what they were in the 90s when we had this huge amount of money pushed towards getting our syphilis numbers down. Well, when the numbers went down, the government shifted those funds and now our numbers are back up. So when you start to think about all of our different, we'll say orifices there, when you have these other STDs there, you increase the probability of getting HIV. So these unhealthy environments that have gonorrhea, chlamydia, syphilis, we call them riders for HIV, gonorrhea being the main one. So if you've got a man who has sex with men who has rectal gonorrhea, if he doesn't change his sexual practices, guess what? Within 6 months, he's going to be HIV positive. If you've got a young woman who has syphilis, and that's what we're seeing, those syphilis numbers, they're more prevalent in heterosexual women.
Wow.
Not MSMs. They're more prevalent in heterosexual women. So when you've got those numbers up, you're going to see those transmission rates higher in those populations. And so when those environments are unhealthy, you're going to see also HIV go up in those populations as well. And I see a lot of good questions in the chat about schools. Well, guess what? My husband's a principal. And I have attempted to do or assist where I can with health fairs at the school. I can't bring up sex. If the kids ask me about it, I can answer the questions, but I can't bring it up. I cannot. If they ask, I can answer, but I can't bring it up. But I have been fortunate enough, my PhD is in nursing. So the University of Mississippi Medical Center School of Nursing, they have a program where they're working with some high schools in the Jackson area, and they have school-based clinics. And so we can, when we're in that room, if that teenager asks us questions or they vocalize some concerns about STDs and testing, then we can answer those questions, but we can't bring it up. And so it becomes,
Go ahead.
Mauda. No, I was just going to say, it becomes one of those things where that's a barrier that we have not been able to overcome. So I have been working with, and this is where I will be reaching out to all of you all as panelists. I've been working with a young lady that is in DC, and we're working to establish a coalition that will be working on policy, because these are really about political determinants of health. And we've got to look at policy. This is about policy. We have got to have a coalition where we can work on policy that would allow My Brother's Keeper, Express Personal Health, and organizations that are not a part of the State Department of Health to get funding to do testing, to do STD testing, to have a streamline of revenue where we can do STD testing. And I'm not saying that the State Department of Health doesn't do it, but some of us are a little bit more creative in doing it and catering to populations, and we can do it, but we've got to have an avenue and a revenue stream that will allow us to do it and expand screening and testing opportunities to populations and increase that. And that's the way we can do it. But we've got to have policy change, and we have to be able to tap into that stream of revenue.
The chat is blowing up right now, and I can't be a moderator if I don't hit some of these questions that are in the chat. So this is from the audience. A person asked. So I'm actually going to shoot this to Linda, and I'm going to shoot it to Dr. McGoy. But what is your opinion on why Blacks are more likely to die here in Mississippi? Do you think it is a lack of knowledge, of the possible health problems that come with HIV, technology, or medication. So, Linda, because Jennifer mentioned policy, I think that has a lot to do with policy. So I'm going to start with you, and then I'm going to shoot it over. Just take a few moments, and I'm going to shoot it over to Dr. McGoy.
Thank you, Mauda. And yes, Jennifer, Mauda, you're right. A lot of it is rooted in policy. But let me just say, stigma is deeply rooted in all of this. And we need to call it out for what it is. Stigma is the negative attitudes and beliefs about people living with HIV. We need to get past that so that we can help our people, so that we make sure they have the education, the knowledge, to just know what's out there and how to address it. But we've got to get past the stigma on this and the labeling, and just call it out for what it is, and the moral judgments against even somebody who, the perception of somebody having HIV. I think, HIV is the only disease I know of that's criminalized. That's a problem in itself. That's frightening. That in itself is just scary. So, policy is huge. I think, going to communities are very important. At the Mississippi Center for Justice, we have an annual event every year. We bring together policy makers, people living with HIV, AIDS service organizations, health providers, lawyers, and others, where we actually come together and talk about the unmet legal and policy needs of people living with HIV. We don't do what we think needs to be done. We go to the people and find out what issues and concerns they're having, and then come back and we translate this convening into policy priorities that we can work on. And the priorities are the same all the time. Employment discrimination. People need jobs. You got to be able to work. And if you're going to work and you're having discriminatory things happening to you, that's a problem. But there are federal protections under the ADA for people living with HIV they don't even know about. So that's a huge thing that we're trying to do, is even educate Mississippians, whether you're living with HIV or not. It could be a loved one, on your rights and your federal legal protections, because we don't have any state protections in that regard.
Dr. McGoy, what about you, Dr. McGoy? What do you think about that?
Yeah, so we talked about two things already, and just to hit on those, the stigma that Linda talked about, as well as the lack of comprehensive evidence-based HIV and sex education. It's a policy issue related to that as well. So if you have someone who's matriculating through school, they get to 18, they graduate from high school, and they still don't know how their body works or how to use the correct titles, or how many pieces are down there. That's the problem. It's problematic. And so with that, they're not able to understand their risk for HIV. In addition, I wanted to talk about the healthcare system, particularly in southern states. When we talk about the healthcare system, the lack of expansion of Medicaid is one issue, another policy issue that I'm sure Linda could address, as well as the shortage of providers. There's already a shortage of providers in healthcare. But then when you talk about people who have the expertise in HIV-related care, there's even more of a shortage. And then those who are culturally competent to care for Black, Latino, and LGBTQ communities, that's another issue in and of itself, as well as the distrust, the historical distrust that Black communities have related to the healthcare system. We've seen that play out in COVID-19. We've seen it in terms of tested for COVID, in terms of knowing risk, and as well as I mentioned lack of healthcare service, and then limited services for substance use programs and mental health and trauma-informed care services. How many people we know, family, friends, who have substance use problems that aren't getting addressed, as well as mental health problems, that there are not the services readily available enough for people to access and get there. So there's a number of reasons, and the list can go on. Travel, distance people have to go to get the care.
Yes. You brought up so many different things. So when you start to ask the question, why Black people, we are late to testing. So by the time we figure out that we're HIV positive, we're already at a point of an AIDS diagnosis, right? So HIV is the virus, but AIDS is the disease. And the disease comes about when your immune system can no longer support itself, right? So that you're talking about your CD4 count. Your CD4 is basically your immune system. It is below 200. But here's the bright point is that the medications have changed. They have changed so drastically. We're now at one pill once a day for many people who are HIV positive. Those who are newly positive, and even some that have been positive for very, very long periods of time. So,
and I will say this too, Mauda. I have been lucky enough to be a part of one of Gilead's clinical trials. I'm sorry, ViiV Healthcare's clinical trials, where we are now doing an injectable, and it hopefully will come out early spring, where they're just doing injection once a month.
So much.
And there are so many other things that are coming out for patients that makes their lives so much easier.
That's such an important thing to bring up, Jennifer, that it makes it so much easier. I want to throw this question to Pastor, and then we got a question in the chat. So take just a few moments, Pastor, if you can answer this question. But we've talked a lot about education, right? So people don't know. That's what today is about. It's about people being able to ask those questions. But what is the church's role? LaTunja talked about it was her pastor again, her pastor's wife that brought this to her. But what is the church's role in providing more education around HIV? And after Pastor LaTunja, if you could talk a little bit about, from your perspective, seeing that it was your pastor's wife who brought this to you, Pastor, what's the role of church when it comes to HIV education? And LaTunja, what have you seen change since your own diagnosis? So, Pastor, starting with you, take just a few moments. You're on mute. You're on mute. So okay, it's still on mute. LaTunja, if you can go to that, Pastor, while you get your sound up. LaTunja,
can you hear? Can you hear me? Okay. So over the years, I have seen churches come. So I'm from the Kojic background. And I've seen a lot of these churches even invite me to come to women's ministry days to have conversations here in Arkansas. I've gone and I've talked to some of the youth groups at some of the churches here in Arkansas. They've been very open. I just try and frame my conversations in a way that it still fits for people that are in the church. So you can have an HIV education session with individuals in the church from all ranges. You just have to know how to use your right words when you go into the churches. When we do our education with the drug courts, we use language that drug court individuals would listen to. And so it's all about tailoring that message to the audience. I oftentimes hear when I go to the churches, well, I've been married for 10 years, or I've been married and I oftentimes say, or I've been in the church for this long. I just remind them that I'm a woman. I've been in the church for years as well. I was engaged to be married, and they look at me like, oh my God, I wasn't aware. And so just having those conversations, the church can play a critical role, because a lot of African Americans, they look up to their pastors, they look up to the pastor's wife, they listen. Had somebody else brought this to me about going to get HIV testing, I probably would have just blew them off. But because of that relationship that I had with my pastor's wife, the trust that I'd built up there, they are an amazing group of people at that church. And I felt comfortable enough to have that conversation, trusting her, even though I didn't know what I was walking into, because nobody had educated me about HIV. I really didn't even know about it. And so to have that trust in my pastor's wife enough to go and just by faith, trust.
Oh, that's such a powerful statement, that you don't think you would have gone had it not been for your pastor's wife. If someone else had told you that to go and get tested, you don't think you would have gone. So Pastor, can you hear? Nope, we still can't hear you. I don't know what happened with Pastor Sam, because we have some deep burning questions over here, because they saying that the seasoned church members, find themselves being sexually active too. And I'm glad you brought up, LaTonya, you brought up the point that people oftentimes think that HIV is a result of you going out and you're doing this and you're doing that and you're sleeping with this person and sleeping with that person, but you were actually engaged to be married. This was not some guy that was random, and and that's too often, that's the stigma around the disease also, is that women or men are out there and they're having just sexual relations with any and everybody, and HIV is a result. I'm gonna bring this back to Pastor, but when he gets his sound together, I want to bring this question up. It was a question from the audience that, as a parent, when is the appropriate age to talk with your child about sex education? Because in today's society, kids are being exposed to sex earlier and oftentimes know more than we do. And that's true. Kids have the internet at their fingertips now. Someone mentioned about young people and HIV. I will say here in the state of Mississippi, we have some very, very high case rates of young people. Jennifer, I'm going to throw that to you, because you're in the clinical setting. So you're seeing people come in. Tell us a little bit about the young people you see coming in, and just a few moments to hit on how can a parent actually start this conversation around HIV and STDs with their little one.
So my rule of thumb is, we know our kids. We may not want to really honestly accept it, but we know our kids. My son, my age, always 9 or 10. I know that may sound really, really young. People may not be willing to accept that, but that's my age. My son just turned 10. And I have been spot checking him and having that conversation since last year. And that's just my rule of thumb. In the state of Mississippi, you can get tested and treated for STIs, STDs. I think, tell me if I'm wrong, Mauda, I think it's 13 and older without parental consent.
Yes.
So your child can go to a clinic and get tested and treated for an STI, STD, 13 and older. So if they can do that at that age, I think it's very, very, very likely that you need to have that conversation with them at least before they get to that age.
Yeah.
That's just that's my rule.
I agree 100%. So that is very true. Nope, we still can't hear you. I think that is very true. We have about 20 minutes left. And so I want to make sure that I do mention the fact that you brought up a valuable point, that young people can go into a healthcare provider in the state of Mississippi at the age of 13 and seek what they call reproductive health services. Now, HIV testing is a part of that. STD testing is a part of that. Pregnancy testing is a part of that. I hear a lot of parents say, "Oh, but I'm bothered by it. I would be upset. I would be mad if they didn't call me. I would be mad if they didn't tell me. I would be this. I would be that." Linda, take just a few moments and tell us a little bit about how the law protects that child as it relates to HIPAA, and why young people should be able to actually go in and seek those services when needed.
The reality is, young people are not going to talk to their parents all the time about these things. And so for them to have a place they can go where they, have a trusted healthcare provider, I think is important, because they may not have anywhere to go. And it's not, we're not, I think you said that the schools, even at health fairs, you can't initiate the conversation, but you can respond to a question. I mean, how many children are going to bring that up? So I just think that it's really important to have safe spaces where anyone can go, regardless of their age, especially a child who may not be getting it from anywhere else.
So I didn't want to miss this question. An audience member asked this question. Is how do we begin to change the negative stigma of HIV in our African American community? So I will ask that. I will shoot that to you first, Latunja, and then Shanell, if you can mention that because of the work that you work in with Compass, Latunja, starting with you, how can we begin to change the negative stigma of HIV in our African American community?
I think we just need to learn to have more conversations. I think not just around HIV, but sex, period. A lot of times we're afraid to have conversations about sex, and especially women. We don't feel like we can ask our partners questions. We don't feel like, I oftentimes tell people, when we get ready to have sex, we turn off the lights and we don't turn them on. And so turning on those lights for a minute, having those conversations, making it normal, everyday parts of conversations, not highlighting HIV is like it's supposed to be stigmatized. Going back to what Nurse Jennifer said earlier, you have to make these everyday parts of everyday conversations, not stigmatizing them when people go to the doctors, making sure that the doctors are not stigmatizing it as well, because oftentimes you see doctors that can also add to those stigmatized ways and practices. So making sure we use the correct languages. People don't die from HIV, they die from HIV complications. And so making sure people understand all of these things as how HIV is transmitted. Once we start having real conversations with people, I think we can get rid of HIV, making sure that they're educated about what HIV is, how it's transmitted. And again, going back into those school systems. I've been very fortunate to be able to work with one of the programs. I think as early as we can start having those conversations, we can start making it part of that everyday conversation. We're working with one of the schools and the students are really interested, ask questions. It's part of an Excel program where we're able to just work with students we were able to get in because they were in a health related field. So we're able to get in and work with those students, and then we encourage them to go out and share that information with their peers so we can start like this peer navigation. So if we get it in with some students, and some of the students have been very proactive in wanting to go out, have us come out and just talk to their friends. So finding those creative niches to get in to start having those conversations early.
Okay. Dr. McGoy, if you can take just a few moments, and then we will actually start the wrap process. So, Dr. McGoy, if you take a few moments.
Sure, thank you. So, everything that was said, we need to change policy, of course, having sex positive conversations that educate people about sex and about HIV. Instead of that 12-year-old girl who's pregnant, getting ready to have a baby, instead of shaming her, love on her, to encourage her to learn more, to pursue her goals and education so that she can be self-sufficient, knowing that she is valuable. And I think the project does that. But in addition, acceptance of our LGBTQ community. And I think the other thing I want to mention is normalizing and embracing healthcare. There may be fear about going to the doctor, about what you might find out. I know for sure, myself personally, I struggled with my dad 2 years to get him to go to the doctor. 2 years to go to the doctor. And I know that's common among so many other Black men, but also Black communities where people just don't want to go to a provider. They wait until they're on the deathbed before they actually go see a doctor. So making sure you can find a provider who meets your needs. It's just like any other relationship. You find the right provider who can give you what you need in terms of your health care. And so before we wrap up, the other comment I wanted to say is that the Gilead Compass Initiative, you can find us at gileadcompass.com is the website. So we fund organizations throughout Mississippi, from Cleveland to Jackson, all the way to Hattiesburg. We fund community-based organizations doing the work. And in fact, one of them I wanted to highlight, the Southern Health Commission. We worked with the Southern Health Commission, and they were able to, as a result of their Compass experience, they were able to receive $1 million grant from SAMHSA to address substance use in Black communities. So that's the type of work that the Compass Initiative is doing, working with community-based organizations by funding and grant opportunities, providing them with training, providing them with learning, cohort-based learning, but also giving them the tools that they can use to leverage their experience and get other funding. So check us out. We've got some new things coming in 2021 that I'm sure that this conversation touched on, and I'm sure many people would want to learn more about. So GileadCompass.com, and you can learn how to get funding and learn how to get support.
All right. Thank you so much. Pastor, are you back with us?
Can you hear me?
Yes, we can hear you. So, Pastor, I'm going to give you your closeout now.
Okay.
What I wanted to ask you, your final question, take just a few moments to and to respond to this question, is what can the church do to increase education around HIV? And what challenge would you put out to other pastors to do around HIV related work?
Okay. A few things. I think the church should frame HIV as a social justice issue, first of all, because if the church frames HIV as a social justice issue, the church is quick to speak out on Black Lives Matter, things of that nature, racism. If HIV is framed as a social justice issue, then we have no excuse to not speak out. I heard someone mention this earlier about conversations need to be had. I'm 45 years old, and I my father was the great preacher pastor. I'm 45 years old, and I've yet to hear my father have a conversation with me. And that goes back to teaching our children, our sons, and our daughter. Now, no age, in my opinion, is too early to start forming or having. As it relates to the church, I think each church should have a HIV, not just a health, but a HIV ministry. If a HIV ministry is put in place on a yearly basis, quarterly basis, things in the community as it relates to HIV. So my challenge to preachers across the city of Jackson is violent. Allow it to be a social justice issue. Put it on your church calendar yearly, and become actively involved in that ministry.
Pastor Tobias, listen, I think you just gained you some new members. Some gonna be coming over there to New Mount Zion. This is not only a friend, but he is certainly for me a leader in my spiritual walk, and I appreciate him for being here. Miss Linda, give us some closing remarks regarding the legality. You mentioned ACA. Take just 1 minute and give us a closing remark.
Absolutely. Pastor, you are absolutely right. This is a social justice issue. This is a racial and social justice issue. It's a human rights issue. And I think about healthcare policy, which includes expanding services, testing, and health coverage. There are all kinds of benefits under the Affordable Care Act. And one that Mississippi has not taken advantage of is expanding Medicaid. There are almost 300,000 Mississippians that would gain access to quality health care if our state expands Medicaid. And you want to know about testing and access? If we do that, we can help so many more people.
So much. Thank you so much. Let's see. Jennifer, give us your closing remark. 1 minute.
Okay. I just want anyone who needs any testing, please come to Express Personal Health. You can give us a call. You can come by. You don't have to have an appointment. Just come by, get testing. We also do hepatitis B and C screening services for free. We link patients to care if they're HIV positive, if they need treatment for hepatitis B or C, and also if they have not been vaccinated for hepatitis B. We come to churches Pastor Tobias, we will come to your church and do any type of screening services that you need. So just let us know any way that we can, and I will be leaning on all of you all as we start this new coalition to change policy so that we can expand these services and remove all of these barriers to screening and healthcare services.
Ms. Latunja, 1 minute. What's your wrap statement? You're on mute.
Sorry. I encourage everybody to go out and know your status and to share what you've learned today. I think sharing and starting those conversations, I have t-shirts that I give away that says I slay, and ask me what I slay. And it always, it's slaying HIV, slaying that stigma around HIV. People ask me, why do you wear those t-shirts? They're conversation starters. Have those conversations with someone. Share what you've learned today. HIV is treatable. It's preventable, and we can get down to zero if people would just take the stigma out. HIV is no different from any other STD or any other chronic disease, and if we treat it that way, we can get down to where we have zero transmissions, because we have medications out there to keep people from giving HIV to others. We have medications out there to prevent you from actually getting HIV even after exposure. So there are many ways to prevent HIV, and we should take every avenue that's available to us.
Awesome. Dr. McGoy, and then I'll come right behind you. It's going to be a tough act, but you got 1 minute.
Yeah, thank you so much. Just emphasizing again, Gilead Compass Initiative, Gilead's 10-year, $100 million commitment to address HIV in the South. And I mentioned we have a number of organizations in Mississippi who are funded, from the Delta Health Alliance in Leland, Mississippi. We have My Brother's Keeper, of course, Mississippi Center for Justice, Southern Health Commission in Greenville, Mississippi. So find more information, GileadCompass.com. I also wanted to emphasize this idea of status neutral. Even if you are negative for HIV and you are participating in behaviors that lead to HIV, there are still prevention measures that you can take. If you're HIV positive, get on treatment and care. So this idea of both being either being negative or positive, there are ways to protect ourselves from HIV, and it doesn't have to be a death sentence that it had been for so many years. And we can change these statistics that we've all quoted today by really, getting people into care, getting people tested, and being able to overall just show love and compassion and reduce the stigma related to HIV. Thank you for having me today.
So as I prepare to close out, I want to just say to all of you all, thank you, thank you, thank you. This has been a rich conversation. It's been a good conversation. It's never enough time because there are so many things that we could hit. But thank you, each of you, for taking your Saturday morning and spending with me and the ladies of Delta Sigma Theta Sorority Incorporated Jackson Alumni Chapter. Just want to mention again, HIV is 100% preventable, whether that's condoms. There are medications out there that will prevent you from acquiring HIV. And there are also medications out there that if you have an exposure and you know your point of exposure, you can actually come in. It's a short window, but you can come in and you can get tested, and we can make sure that you stay HIV negative. But if you're positive, it is not a death sentence. Your life is not over. It is better to know and get in care as soon as possible than to not know and ultimately lose your life to HIV. Let's change these statistics. We can start with going to Open Arms Clinic, 500 East River Place, Jackson, Mississippi. Today, you can go and get an HIV test at no cost. It's free. We're going to do HIV. We're going to check your blood pressure. We're going to check your glucose. We're going to check all of it. So go over there. If you need to call, the number is 601-500-7660. Go in. If you don't want to go today because you think everybody going, that's fine. We'll be there Monday. So if not Open Arms, go over and see Jennifer. So you see Jennifer's face. You see, she's easy peasy, comfortable. Go in, get your status, get your test, find out where you are. Take this time, take this conversation, take it and give it to somebody else. Thank you so much for rocking the ribbon with us on this Saturday morning. I turn it back over now to the ladies of Delta Sigma Theta. Thank you so much for having us.
I don't know about you, Facebook friends, but I have learned so much from this webinar. The members of the Jackson, Mississippi Alumni Chapter would like to thank Dr. Mauda, Monger, and our expert panelists for taking the time out of their busy schedules to keep us informed and spreading the word and knowledge about HIV/AIDS throughout the community. We can defeat the spread of HIV/AIDS by working together as a community. Let's continue to rock the ribbon together. Just a reminder now, those of you who have signed up for the motorcade, we need you to head to the fairground now so we can continue to rock the ribbon together. We'll see you at gate number 1 at the fairground. Thank you so much for joining us today. Be blessed.
Join us as we rock the ribbon together.
Join us.
Join us
as we rock the ribbon together.
Join us as we rock the ribbon together.
Join us.
Join us.
Join us as we rock the ribbon together.
As we rock the ribbon together.
As we rock the ribbon together.